Schizophrenia. Schizophrenia is a severe and persistent mental disorder that has an impact on a person's thoughts, feelings, and actions. It is a complicated condition that can be difficult to detect and treat, and it can have a big impact on a person's life. Symptoms of schizophrenia: positive, negative, and cognitive symptoms are three major categories that can be used to describe schizophrenia symptoms. Positive symptoms, such hallucinations, delusions, and disordered thinking, are experiences that are added to a person's mental state. The experiences that are eliminated from a person's mental state are known as negative symptoms, and they include things like a lack of drive, a reduction in emotional expressiveness, and social disengagement. Cognitive symptoms include issues with attention, planning, and decision-making, and are associated with thinking and remembering. One of the most prevalent positive signs of schizophrenia is hallucinations. They entail experiencing unreal sights, sounds, or sensations. The most frequent type of hallucination is auditory, in which sufferers hear voices that are not there. Delusions, which entail false beliefs, are another typical symptom of schizophrenia. A person could think, for instance, that they are being watched or that someone is attempting to harm them. Another defining feature of schizophrenia is disorganized thought, when the person has trouble successfully speaking and organizing their thoughts. Schizophrenia's cognitive symptoms can affect a person's capacity for thought, judgment, and future planning. These may involve challenges with executive functioning, memory, and attention. The ability to engage in therapy may be more difficult for those who have schizophrenia since they may have trouble understanding and being aware of their disease. Causes and risk factors. Although the exact origins of schizophrenia are unknown, it is believed that a mix of genetic, environmental, and developmental variables play a role in the disorder's emergence. Studies indicate that those with a family history of schizophrenia are more likely to acquire the illness, and genetic factors are assumed to play a key role in the development of the disorder. Environmental variables that might raise the chance of developing schizophrenia include stress, trauma, and substance use. Furthermore, believed to play a role in the emergence of schizophrenia is the growth and functioning of the brain. Schizophrenia sufferers have been found to have structural and functional abnormalities in their brains, notably in the prefrontal cortex and limbic system. These anomalies may affect how the brain manages emotions and information processing, which may result in the emergence of schizophrenia-related symptoms. Diagnosis. Schizophrenia can be difficult to diagnose since its symptoms differ greatly from person to person and frequently coexist with those of other mental illnesses. The presence of at least two of the following symptoms for a significant amount of time over the course of 1 month meets the diagnostic criteria for schizophrenia. These symptoms include delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. Treatment for schizophrenia is a mix of medication, counseling, and support services. For those with schizophrenia, therapy aims to increase functioning, lessen symptoms, and all-around quality of life. Antipsychotic drugs are the mainstay of treatment for schizophrenia. These drugs can aid in reducing the disorder's more favorable symptoms, such delusions and hallucinations. Antipsychotic drugs can be divided into two categories: first generation and second generation. Antipsychotics of the first generation, usually referred to as conventional antipsychotics, are frequently successful in lowering positive symptoms. Nevertheless, they could also result in tremors, stiffness, and movement abnormalities. Atypical antipsychotics, or second-generation antipsychotics, have less adverse effects linked to movement and can also aid in reducing unpleasant symptoms. They could, however, result in weight gain and other adverse metabolic consequences. Psychotherapy. For those with schizophrenia, psychotherapy can be a crucial part of their treatment. One strategy that is frequently utilized is cognitive behavioral therapy, CBT, which aims to assist people in recognizing and challenging harmful thinking patterns and behaviors that may lead to schizophrenia symptoms. Moreover, CBT can aid in enhancing social and problem-solving abilities, which can enhance overall performance and quality of life. Family therapy has the potential to be helpful as well since it can enhance family ties and communication for people with schizophrenia. Support services. For people with schizophrenia, support services can be a crucial part of their therapy.